I'm excited for this episode. Our guest today is Yehudis Karbal, which has been a therapist for the past 40 years and has lots of experience in this area. Yehudis has a master's in psychology and is also one of the best educators around. You start listening to her, you do not want to finish. So hi, Yehudis, and
Hi.
welcome.
Thank you so much, Esther, for that beautiful introduction. I hope I can live up to it.
You are. And Yehudis, tell me a little bit how you got involved with Sparks and with moms with postpartum.
It's a long story that I'm going to try to make very short. Basically, I have 4 children, Baruch Hashem. 3 were born naturally, and the 4th was born emergency cesarean, in which I almost lost my life. And those days, 45 years ago, nobody talked about that because you were just happy to have a normal child. So be quiet about your experience, and there's nobody to discuss it with. 12 years after that, I was in a class on grief therapy with the best class of my life. And the instructor was asking us about grief experiences, and I had never seen my birth as a grief experience. But when she finally got to it with me, and I read some books on emergency cesareans, I began to understand what I had gone through 12 years earlier. Fast forward, I was asked by somebody to be a doula. I lived in Chicago then. And because of my own experience, I was really happy to go with somebody else, even though I had not had any instruction in being a doula. But I pretended, and I knew what I was doing since I had children. And then I went on to have more than 100 babies. I got actually certified as a doula, went on to have quite a few babies. And then luck would have it, Hashgacha Pratis, I met you, Esther, a few years ago, and you were involved with Sparks. And I was so thrilled that there was finally a platform to help new moms and older moms. And I said, this is for me. This is what I would love to do because it's all about education. And where there's education, there's so much less fear and such greater levels of happiness.
Correct. I totally agree with you. And I'm so lucky too that we met.
Yes.
And remembering that meeting in Chicago we had. And then the training that was for social workers and community leaders, because you are right, education is the key.
Mm-hmm.
Now, how real do you see postpartum? Because not just 45 years ago, even when Sparks was founded, which is 16 years ago, there was also no talk about postpartum. I remember coming out and being in different newspapers, and I think I mentioned that already last episode, is me being in schools and counseling children and seeing the need. And when myself, with my being a teacher in high school and seminaries and having many young moms coming back to me and complaining about how they feel after a baby, and I found all kind of psychological reasons and different things. The last thing I was thinking about, that this could be a hormonal disorder. So how is it that you see it from your point of view as being a professional?
I just call it a natural progression from being, not having a child to having a child. The transitions that a woman goes through from, again, being childless to having a child are so enormous. And again, because of the lack of education, no one takes it very seriously. I think hormones is part of it, but then there's also so much more, because very often having a child will open up a whole Pandora's box of difficulties, of problems in life, of previous traumas, of what they've heard about birth. So again, a woman is very often set up in a very negative way for the birth situation. And if she doesn't have the education or the support, she often is left feeling bereft and lonely and isolated, and that maybe there's something really wrong with her because she's having all of these symptoms. She may not be connecting to the baby the way she needs to. But again, there's so many complex reasons for all of this. And if a person would know beforehand what she might anticipate, what might happen, the feelings are normal, and that she has resources to relate to. Thank God for Sparks. It makes the situation much difficult. Still intense, but perhaps not as intense and not lasting as long.
Yeah, I agree with that. What I do want to, emphasize on, that you are right in the fact that with the right education awareness and even doctors like obstetricians, they're going to tell you about high blood pressure, maybe diabetes, maybe. No one talks to you about perinatal or postpartum hormonal difficulties. They just don't talk about it.
Exactly.
So I agree on that. However, I do think from my experience in Sparks, and probably speaking by now to over 30,000 moms, you have cases where it's very hormonal, like Dr. Twersky used to call it a hormonal disorder.
Yes.
The hormones are just so gaga that no matter what, with education, with the right help, night nurse, baby nurse, chef, you name it, the mom is still not going to be well. And by understanding that it deserves the attention, just like any heart condition.
Of course, sometimes medication is necessary, and no one has to feel that they're a case because of that, simply that their hormonal issues need to be addressed. Correct. And if it can be done through medication, then that's what has to happen.
Correct.
And for a person not to have to feel that they're less than or that they're missing something in their lives, simply that this is a realistic situation where they need to get the best help possible.
Correct. And talking about medication, which is hard for some moms, because I have never been on medication. Yeah, you have never been, but you have never been on the Tamiflu if you didn't have the flu before. So the medication is not always the answer to everyone. And that's why, it's so important to evaluate every case just for itself.
Right.
But what I do want to say, and I think you would agree with me, that medicine alone is never enough.
Correct. It always has to be medicine with a combination of other support, for sure.
Yeah. So if you want to tell me more about that from your experience, why is medicine alone not enough? And for PPD, which we see that it's something real, and what are other support systems that you see would be helpful, in short?
So having a child can be a very lonely process, even though there's a lot of celebration and joy and excitement and the anticipation of having a baby and afterwards the baby, and the baby is so cute. But if the mom is not feeling well, and if she's dealing with not just the postpartum issues of, the actual birth, perhaps a traumatic birth, perhaps a birth that she did not anticipate or didn't want. It didn't go according to her birth plan. A lot of women go in with a birth plan, but it doesn't work out that way. And then she feels either deficient, that she didn't live up to what she had planned. Sometimes the actual birth process can just release a lot of anxiety that was there in a very early age, but was hidden very well. And then the birth of a baby just opens a woman up to a lot of things that she did not expect. Yeah. So I think the shock factor, the fear factor, the suddenness of being home alone with this child, and now what do I do? So many factors enter into this. A woman who maybe have been very educated, may have been a career lady, and all of a sudden she has a baby and she doesn't know what to do even. The baby's colicky, the baby's up all night. Losing sleep is probably one of the main factors in terms of, how it affects a woman, how badly it affects her. So again, this isolation and feeling that we have to do it all alone.
Right.
Which is
and
unfortunately...
someone that's so dependent on me 24 hours.
Yeah.
It's as lovely as it is, but here you have a newborn which cannot speak for himself, do anything for...
Exactly.
It's a feeling of someone being very, very dependent on you, which can be very hard too. So that's why you're saying that the support system all around, besides medication...
Yes, to be able to talk about it, to be able to validate what you're feeling without feeling like there's something wrong with you, but to normalize this as part of life, it's extremely important. And very often, if there's other children in the home, like a 2-year-old or a 3-year-old, they'll tell the mommy after a week, so when are you going to take the baby back to the hospital? And sometimes a mommy feels that way. I can't do this. I don't know how I can do this for the next 20 years. And this idea that somebody is attached to you and dependent on you for everything is quite overwhelming.
It is. And there is so much. Let's go back to the transitioning that you're talking about. What are like the main points that you find are hard in transitioning from, actually, even if we talk about having a first child, so from being single to being married,
right,
which is from one person to become two people,
right,
and then when the child is here, so from one person to become three people.
Correct.
So what are the main points you will stress on as far as transitioning? What are the main core points?
Well, I would say one of the main core points is becoming public after being such a private individual. Once I have a baby, it's almost like a public event. People are asking you, how's the nursing going? Like all kinds of questions that we may not want to talk about. Nursing is also another issue. Some women find it difficult to nurse, or they need help nursing. Again, this was not available years ago. Thank God now it's available. So from the private life to being a very public life, even in the hospital being very public, doctors walk in, nurses walk in, and there you are. So all of this is for some women, depending on their personality types. There are some who are way more sensitive, some who are not as sensitive. So all of this works on a person's psyche and can start to bring them down. Then if there's isolation, if the husband is not available, he goes back to work, and then a woman is suddenly all alone. And there's expectations. Who's supposed to do what? Who's supposed to help me? So again, the isolation is a huge factor here. A person could feel very strong before having a baby, and then all of a sudden they have the baby and they're in a weakened position. They don't know what to do with these new feelings. And again, it's very hard to get it validated from other people. There's all of the shoulds and the woulds and the coulds. I should be happy. I'm so grateful, but on the other hand, I don't feel good, and I'm not getting enough sleep. And my husband, I don't know where my marriage is right now. I don't know how to fit this baby into the marriage. So it's a lot to juggle. That's all I'm saying. It's a lot to juggle. And I think it's more common for a woman to have these feelings than not to have them. And in my experience in dealing with women who have, have gone through this, I think that feeling that there's something wrong with them is what affects them the most, especially if they have to take medication. So I'm always very encouraging of women. Could be a very short time experience, the medication, but if you need it now, you need it, period.
Right. And also normalizing.
Normalizing.
I totally like that point you made, because I see over and over, am I normal? Will I ever be normal?
Right.
Am I the only one that struggles that?
Correct.
How come no one talks about it?
Right.
I never heard anyone speaking about it. Must be I'm the only one.
Exactly.
No one in my family ever had it. And then they don't know that their own sister was struggling.
Correct.
Because it's so much shame, stigma, and shame that no one talks about it. So I totally agree on that feeling of loneliness.
Yes.
I'm alone.
Yeah.
I'm no one else. What is wrong with me?
Right.
I could have, I should have. I always say, if you could have, you would have.
Right, exactly. Exactly. I find that the whole therapeutic process, not just with postpartum moms, but in general, it's an education that, look, the whole world suffers with this, not just you. You're not alone, and there are resources. And all of this is meant for your growth, not to knock you down and make you feel less than, but on the contrary, to help you find your power. And I think that's what Sparks does. It really helps. I mean, the very name Sparks to me is like, spark.
Yes, spark it up.
Spark it up.
Bring in that spark to that darkness. And
exactly.
It's not going to be dark forever.
Yeah.
Even it seems like.
Yeah.
And it's so hard to see that it's not going to be dark forever.
Exactly.
So hard.
Because when you're in the middle
of
it, and you are alone because you have not understood that there are resources out there. I think really that this information should be put in every hospital Every mom should see it. Every birth coach. People should know what's out there. And then this movement should really help to heal the whole situation with birth and what goes on afterwards. Because sometimes I'll meet a woman even 2 or 3 years later, and they're still suffering from the after effects. They may not feel like they're still postpartum, but there's something niggling at them. There's something that makes them feel less than.
Something doesn't sit right.
Right.
Yeah.
Exactly.
Something doesn't sit right. And what you mentioned is previous traumas. That's a big one.
Right.
I mean, when we talk about postpartum, we know that we have 6 different kinds. We have the depression, the anxiety, the trauma, the OCD, which looks like OCD, the bipolar, and the psychosis.
Yeah.
So we know that there are different types, and trauma is definitely a big one.
Yes.
Where past trauma comes up, and it's kind of very, very scary, because if this can be a mom that she feels that she had trauma in her past, but she has gone for therapy, she did trauma healing, and her life is in order. And all of a sudden postpartum comes in, and it is so not in order.
Right.
Everything is upside down. And that's by itself is very scary.
Right. Because another transition is from having control over a life to having no control. You know, before a baby, you have control over when you go to sleep, when you wake up, when you eat. All of these things there's control over, and your decisions, and all of a sudden there's a baby, and really very little is in your control.
Correct.
So again,
that's a good point.
Yeah, the lack of control really throws people, because beforehand also we're able to present some kind of a facade to the outside world that everything is fine, Baruch Hashem, and sometimes afterwards we're not able to present that facade.
And maybe also the lack of independency, which we spoke about. So there are so many, the dynamics
very
is
complicated.
very, very changed.
Yes.
And very, very complicated. Even without going into very biochemical factors that take place in some moms. But just even now, also I find that moms are very much mistaken between postpartum depression to the baby blues, which are not the same.
Right.
And if education on that is also important, and also reach out for help, early intervention.
Right.
And from your experience, who is the first one that calls? Is it the mom? Is it the husband? Is it the family member?
It could be any of the above. Yeah, because very often a woman, again, is very reluctant. And when things get to a situation where there has to be some action, very often it's the husband, because he sees that it's not the same woman that he was dealing with before. Or sometimes it can be parents or siblings. I just think it's important that whoever calls, that we pay serious attention to it, and we don't push away any cry for help, however great it is or however small it is, but we need to address each person individually and take them very seriously and let them know that it does end. There is an end to this.
There is an end. There is light at the end of the
tunnel.
Exactly. Being able to see the light at the end of this, and knowing that just reach out for help. The light is there.
Right.
You will get over it with the right help. And like you said before, the support, medication if needed, and so many other interventions, which we'll get into it, I guess, in another episode, because we can't do them all at once. So there are so much help out there that it's kind of a shame not to reach out.
Right. But again, that speaks to a general shame to reach out and get some help. I once dealt with a woman whose mother, she had a very difficult relationship with her mother. She went to a Kippur place after the baby was born, and her mother somehow bribed the people at the desk, got into her daughter's room when her daughter was nursing.
Oh.
And the daughter didn't have boundaries with her mother. So this aspect, this difficulty in her relationship before the baby was born, was very magnified. And it took her a while till she could begin to establish strong boundaries with her mom. So what I try to do is try to help people see that whatever they're going through is actually a good thing, because it will help them to establish the boundaries that perhaps they never had. it will help them to become individualized from their families who are asking all kinds of questions. Whatever was weak in the person's life beforehand is going to be exaggerated, probably, like setting boundaries. So if a girl doesn't have proper boundaries with the mom, or the mom doesn't with the daughter, and the daughter wants to nurse alone and the mother is knocking on the door, well, I've nursed, I can come in. No, you can't, and that's going to be okay. So again, empowering. We're always talking about empowering. That's what healing is all about.
Right.
That you empower somebody exactly where they're at and let them see that whatever descent they've made, that's how big the ascent could be. In other words, whatever they're struggling with, that's how intense the healing could be. And then it will be something that they have a skill, a lifetime skill, not just for this period of time.
It's a learning experience.
A big learning experience, the biggest.
Yeah. Which is not always so much fun.
No.
It's not. And when you say about boundaries, I find moms that it teaches them how to have better boundaries with themselves.
Sure.
Not just with others.
Sure. Right.
And
even for a woman to be able to say, I deserve privacy right now. I deserve not to have to answer questions. I deserve not to compare with my sisters-in-law who look so beautiful. Another problem, obviously, is the body issue. I had a woman come in, I'll never forget this. She was 7 months pregnant, and she was very depressed. Why? Because she was gaining weight, and her belly was growing. Hello, you're pregnant. What is this? But this was how great her body dysmorphia was, that she didn't even allow for the pregnancy. And then, of course, we had to go back and discuss what that was all about, and she got to it.
She got to it, that's good.
She did. She got to it.
So she was sharp.
Yeah.
So
again, whatever, and I've had people who have been, when they tell me it's 2 years after the baby and they still don't feel well. And then I explain my situation. Well, I was 12 years after my baby, after my emergency C-section, and I still didn't feel so well, but I still couldn't talk about it until I was in that class on grief therapy.
Right.
And I read a book called Silent Knife, and it's all about emergency cesareans. I didn't even know such a thing existed, Silent Knife. But I read it, and it was my story.
For the first time.
Yeah, and it was my story.
Wow.
And I cried my way through, and I said, oh, finally somebody understands what I went through. Because until then, nobody did. But it's interesting that led me to my little hobby career as a doula.
Right.
If not for that experience, I would not have become a doula.
Right. So which means that even if we don't see the light at the end of the tunnel, just believing and giving ourselves those positive messages and the right affirmations definitely help.
Also, a lot of patience, because we live in a very instant society and we want everything to happen immediately. So if a woman could have patience for herself, patience for the baby, don't worry, one day he will sleep. And I think it's, just empowering women with the wisdom to know that they can also be sparks for other women.
Correct.
Once they have
to give back.
Yeah. Yes.
Are there specific demographics that you see more postpartum depression, different age group? How would you
I would say it's mostly by first babies because of the shocks, because of the wouldshoulds and coulds that they've lived with for 20 or 25 years. And then all of a sudden, they're actually experiencing it and they don't know what to do with it. So I would definitely say first-time moms.
Really?
Yeah.
I see the most third-time moms.
Really?
Yeah.
Third time. Interesting.
With the third birth, I always say that I would be so curious to build some kind of a database because
that would be interesting.
Would be interesting
for sure.
Because it's not something I have seen written that I can say, okay, this is the research has been done.
Okay, let's do the research.
I think we should start a project.
But very often, like if I go with a mom, first time, she ends up very often having an epidural. It's not what she wanted, but it's just what the medical team has decided, and for the health of the baby as well. And then after that, a second baby is usually much easier because she already has been through it. She knows what it's like. When a first-time mom is experiencing a contraction, she said, oh, this is okay, this is good. I can manage this. And then, a few hours later, she's not able to manage. And it's very scary very often for her because it feels like there's something wrong.
I hear that very much psychologically. Maybe the reason why I see so many of the third-time moms, because when it comes to a third birth and I ask them for their own history, and then they say, well, not all of them, but, a nice percent. And they say, well, first time, second time, I felt something, but I managed it, which means less reaching out for help.
Right.
When it's not a real devastating call.
Exactly.
I'm still okay.
Right.
But first time mom makes sense of as far as the transition part. That makes sense. But you know what? I have had calls in Sparks where it's after 8 child.
Sure, it can be, for sure.
10 child.
Sure.
It's kind of no guarantee.
No.
And it's real. And reach out.
Right.
And it's okay.
Right.
Even if you didn't. And there are so many other factors that can be triggering this. So let's figure this out. Let's see what it is.
Right.
And what's the age group? You see it, if it's first child, so you're talking about very young moms.
Right.
Which maybe often were not really so ready to have this child.
Right. And very often they're just beginning to adjust to married life. Sometimes there are financial concerns. A new baby is very expensive, and what happens here? The whole system gets jarred. The whole system gets shook up for a while until things settle down.
Right. Even just buying all those diapers.
Yes.
The Pampers,
Right.
Whatever it is,
Right.
and you were talking before about the pressure of nursing, which is a big one.
Huge.
And I tell moms, if you don't nurse, that's okay. I had a woman crying this week to me on the phone, and she said, and I unfortunately couldn't nurse. And maybe that's why I'm not normal. I said, you know what?
Wow.
I didn't nurse either. And I do not consider myself as not normal.
Right.
And she said, and I said, and my mom didn't nurse me either, and I didn't nurse my kids, and I don't think they're not normal.
That's right.
So
again, the education is so important, and the validation. These are the two main ideas here. Let's educate every mom. I think that people should also have the marital counseling as well, especially when the woman is pregnant and the husband needs to know what to expect. He needs to be educated. So we have a lot of work to do
and
here.
And also a lot of those assumptions. If I don't nurse, my baby's not going to be well.
Right.
If I don't nurse, I'm different than the others.
Yeah.
All those
Comparisons.
Messages and comparison, which is so not helpful.
Right. So part of it is also the comparison about, well, so-and-so, she made her bris. She was absolutely wonderful. Of course, her uterus was prolapsed because of it, but nobody talks about that part.
That's what happened to me.
Oh, getting up too soon.
That's what happened to me. Yeah,
but thinking I'm brave and I can do this. No, you really can't. You need to be a Kimpatern. I don't think we have that because we live in this instant society. You don't have 6 weeks as a real Kimpatern. You might have 2 days. I remember in my day, they kept us in the hospital at least several days, and now 12 hours and you're out. That's impossible. No one's ready for that. So again, it's this push and force and comparison and all these factors together.
And you have to be okay, even if you're not.
Yeah, that's right.
You have to.
Yeah.
So, by my second son, I remember preparing the Wachtnacht was on Purim, on the night before Purim. Then, was the night of Purim, actually. And I just wanted it to be very beautiful because I like nice things.
Sure.
And I felt very, very perfect.
Yeah.
And I worked very, very hard. Yes. And then I paid the price.
Yeah.
And then I said,
exactly.
Not smart.
Exactly.
But you know what? At least my next birth, I was waiting 2 weeks until I was running around, which is also not enough.
Not enough.
Right. Not enough.
Right.
You have countries, they give moms a half a year.
That's right.
Because really, the hormones for them to get back to normal take at least a year.
That's right.
So we don't have the luxury of sitting around for a year, but to give ourselves a little compassion and time and understanding, that can be extremely helpful.
Right. And then the idea that a woman should go back to work after 6 weeks, it's really crazy if you think about it. I know some women do have to go back to work, but maybe it should be just a gentle process. But it's hanging over her head and she's not ready. So again, all this force and the comparison, well, so-and-so looks great. She went back to work and everything is fine and working in her house. So again, this, I think women become wise through the process of being educated and learning what's a healthy dynamic, what's not a healthy dynamic. And
what's healthy boundaries. Yeah. And then all of that, absolutely. So, yeah, I think that we all understand now how PPD is real.
Real.
And
again, I always tell people, I don't know how people don't have PPD because of all that we've talked about. So it's almost like, yeah, some form of it, whether it's baby blues or PPD, but either way, it makes sense, and she makes sense, and that's what a woman needs to know.
So you're not surprised that it hits 1 in 5 moms?
Not at all. Not at all. I would say it probably hits more than 1 in 5. But a lot of people are silent. And I think it's not just worth a phone call. I think it's vital that every mother feels a responsibility to protect her own physical and mental health and that of her baby, her husband, her other children. And thank God that there's a place to call.
Thank you so much, Yehudis. It was so great having you here today.
It's wonderful to be here.
And I think this information is just so important for it to get out. So thank you again.
Thank you.